When someone suddenly develops weakness on one side of the body, difficulty speaking, a drooping face, or sudden confusion, they may be having a stroke. A stroke is a medical emergency, and every minute matters. A stroke occurs when blood flow to part of the brain is interrupted. Without oxygen and nutrients, brain cells begin to die within minutes. There are two main types of stroke. The first, and most common, is an ischemic stroke. This happens when a blood clot blocks an artery supplying the brain. The second type is a hemorrhagic stroke. This occurs when a blood vessel in the brain ruptures, causing bleeding into or around brain tissue. Although the causes are different, the symptoms can look very similar, and both require immediate medical treatment. The fastest way to recognize a stroke is to remember the word fast. F-face. Ask the person to smile. Does one side of the face droop? A. Arms. Ask them to raise both arms. Does one arm drift downward or feel weak? S. Speech. Ask them to repeat a simple sentence. Is their speech slurred or difficult to understand? Tea time. If you observe any of these signs, it is time to call emergency services immediately. Other warning signs may include sudden vision problems, severe dizziness, loss of balance, confusion, or a sudden severe headache, especially with a hemorrhagic stroke. Do not wait to see if symptoms improve. Stroke symptoms can sometimes come and go, but even temporary symptoms may signal a serious condition called a transient ischemic attack, often described as a mini-stroke. This is a warning sign that a major stroke may follow. If you suspect a stroke, call emergency services right away. While waiting for help, keep the person calm and seated or lying slightly on their side. Do not give them food, drink, or medication, as swallowing may be impaired. Note the time when the symptoms first began. This information is critical for doctors because certain treatments for ischemic stroke must be given within a specific time window to dissolve clots and restore blood flow. If the person becomes unconscious and stops breathing normally, begin CPR until emergency responders arrive. Stroke risk increases with conditions such as high blood pressure, diabetes, smoking, high cholesterol, obesity, heart disease, and lack of physical activity. Age and family history also play a role. The most important factor in stroke survival and recovery is speed. The faster treatment begins, the more brain tissue can be saved. Your role is simple but life-saving. Recognize the warning signs, remember fast, call for help immediately, and stay with the person until professionals arrive. A stroke can change a life in seconds, but fast action can change the outcome. Face, arms, speech, time. When these signs appear, time is brain.